Hello everybody. In this video, we'll learn about facial symmetry examination, which will come after your head posture examination. You will comment about the facial symmetry before you go on to ocular symmetry. So we'll learn about what are the things that you have to look for in facial symmetry and how will you comment about it in facial symmetry examination. So what do you mean by normal facial symmetry? So basically, there should be a complete match in size, shape, location, and arrangement of each facial component along the sagittal plane. So if you draw a line in the center of the face, so you're comparing one half of the face to the other half, and you're going to say whether it is symmetrical or not. So normally, if you see and if you find it is symmetrical, you will say facial symmetry normal or symmetrical on both sides, and you move on to ocular posture examination. So what could be the abnormal things that you see? The most common thing that all of you are aware is Bell's palsy or facial nerve palsy, where you'll see one half of the face there's absence of forehead wrinkles, absence of nasolabial fold. There'll be leg ophthalmos or drooping of the eyelids on that side. It's a very obvious thing which you would have learned even in ENT, and that is you will not miss that. But please remember, facial symmetry is not only about facial palsy. You have to examine the facial symmetry and comment about it even in other conditions. So what are the other conditions? So if you see proptosis, so you will not leave this to examination of the eye only. When you put a line on across the center of the face, you will see that this part of the face is proptose compared to this. You will comment about the facial symmetry here. One eye is drooping compared to the other. You will comment about it. They're saying there is drooping of the eye, so the face is not symmetrical. There is lid swelling. This is also facial asymmetry, isn't it? So you will comment about it. Or unilateral red eye or any swelling, chalazion, anything when one of the face is not the same as the other, you will comment about it in the facial symmetry during your examination. So please remember, if it is normal, you will say symmetrical on both halves and write as normal, or you write facial symmetry symmetrical. Please remember, if one eye is patched, because it's a post-operative case. If we have given you a operated case and we tell you don't examine this, don't remove the patch, examine only one half of the face, you will not comment on facial symmetry. You can easily say, I cannot comment on facial symmetry because one eye is patched and I cannot see all the facial components. So please remember, if it is normal, you will write it as normal. If it is abnormal, you'll comment about it, whether it's Bell's palsy features or in any ocular examination features, you will comment about it. Thank you very much.